Hello and welcome to this training session on how to detect fractures while you are in A&E doing your day-to-day job, and make sure that you can detect fracture with confidence to enable and to facilitate timely fashion patient care to deliver the best possible outcome. This is a patient presented to A&E. Patient is 64 years old, male with a full and suspected fracture. And the moment you look at this radiograph, I'm sure you will be able to identify there's something wrong at this side. It depends on how level of experience you are. You may spot this kind of on the first look, or it may take you some time by following the bony cortex, which I always recommend. You have to follow the bony cortex all around the radius, and ulna starts from proximal to distal. Make sure you follow the 3 arc lines, one along the proximal aspect of the proximal carpal row. The second line is along the distal aspect of the proximal carpal row, and the third line along the proximal aspect of the distal carpal row, and it should have a continuous arc. And as you come here, you can't see the arc, so there's something there. So we know now there's something along the sides of the arc. We need to look at it on a different view because one view is too few. And if you look here and follow this kind of other line along the base of the metacarpals, you can see there's a straight line here, and then you can't see the line there. Usually it's a continuous line between the joints. So whenever we see bone overlapping and discontinuity of the joint and foreshortening of the fifth digit, it means there's dislocation of the fifth carpo-metacarpal joint and potentially fourth. Usually happens both at the same time. But in this case, you got only dislocation of the fifth carpo-metacarpal joint. Then if you go all the way to check for other fractures, because we shouldn't fall into the trap of satisfaction of search. When we find something major, we stop. You have to keep continuing. And then you follow this line there all the way to the phalanges and coming all the way back to the fourth metacarpal, where you can see a step and bony fragment and irregularity. So there's actually a fracture of the base of the fourth metacarpal. Then you follow the other lines and we can't see any fractures. You keep following, no other fractures. You may see some irregularity here, but don't forget this is a 64 years old gentleman and he could have some degenerative change, but there's no fractures or step like this one or abnormal fragments. When we look at the left radiograph, I think this clarifies the fracture more. You can see a fragment displaced anteriorly here, another fragment displaced anterior there, and you can see the more fragmentation and more disorganization of the bone at the fifth carpo-metacarpal, where you can see the dislocation. You should not assess other bones on this view because it will give you false impression that there is other carpal bone abnormality. You just look at the initial abnormality you saw on the AP radiograph and assess it further. So now we know there's established fifth and fourth carpo-metacarpal dislocation with fracture of the base of the fourth metacarpal. Another lateral view there where you can see the fracture nicely and clearly. We also did the CT scan because of the complexity of this patient, and as you can see here, there is dislocation and impaction of the fifth metacarpal into the hamate, where there's also a fracture there which we couldn't really clearly see, but we suspected there was a fracture there. And here you can see the fracture of the proximal aspect of the fourth metacarpal on this CT scan. And this shows you that it is important to look at all radiographs and all orientation to come with an outcome. And this is like a 3D presentation that we sometimes use in musculoskeletal imaging to give the surgeon an ability to see the effect of foreshortening and where the fracture is. And sometimes it can be helpful in detecting fractures. And here you can see the bony fragment and the foreshortening of the fifth, more than fourth metacarpal joints. And you can see there the foreshortening in relation to the other second and third metacarpal due to dislocation at the fourth and fifth carpo-metacarpal joints. I'm confident that now you will be more confident in analyzing fractures, and don't get intimidated when you see such a complex fracture there. You just need to follow the lines, follow the rules, understand your anatomy, and make sure you know the names of the carpal bones as we discussed in other videos. I will be sharing with you another video just to educate you on the anatomy of the carpal bone as soon as I can. Make sure you share the knowledge. Make sure you write some comments on this video so that we can share the learning points. And see you in the next training with another training video. Thank you.